Thank you very much. Good morning, good afternoon, dear colleagues.
Постараться буквально в течение 10 минут обрисовать, что происходит с антибиотикорезистентностью, каким образом повлияла на нее пандемия.
What happens to antibiotics resistance and how coronavirus pandemic influenced that? Well, at first, I want to share a very interesting publication, which is 8 years old already. So it looked at the influence of resistance to the annual mortality rate. And so about 700,000 die annually from the resistant microorganism. And there is second thing. And if you do nothing to resolve it, then this amount could be increased by 10 million by 2050, which would be definitely more than currently die from oncology. Just 2 million, just 2 million. Now, if we appreciate the data depending on the region, it's important to understand, well, it is absolutely clear that bacteria, they don't perceive any administrative or political borders. So you see that all in all, this is a challenge for every country of the world, regardless of the gender, regardless of the ethnicity. And actually, this is the worst scenario by Dr. O'Neill, because he said that annually the mortality rate would be 10 million. He was criticized by the number of investigators because they call it is estimated data, 700,000. But back in January this year, we experienced brilliant publication, which is a systematic review that includes 204 countries and territories, 23 bacterial agents, 88 combinations agent versus drug, assessment of 471 million individual cases strains, and more than 7,500 years of studies. It is in Lancet, and due to clear reasons, it is dated by 2019. But main 12 infectious syndromes were included, for example, lower respiratory tract infections, bloodstream infections, intra-abdominal meningitis, and other CNS bacterial infections. Also paratype and invasive non-typhoid salmonella, so urinary tract infections, acute gut infections, TB, except HIV-associated bacterial infections of skin and soft tissues, infectious endocarditis, infections of bones and joints, and gonorrhea and chlamydia. Well, if you are interested, I can recommend this article strongly because according to its methodology, again, applying to the real clinical practice, is actually something phenomenal. It is really something phenomenal. For the time-saving issues, I will provide you just few data. So they estimated, this is estimated data, I emphasize it, they estimated the total mortality rate in the patients, the mortality rate related to the resistance, so when the agent was resistant and that led to fatal outcome, plus negative influence to the main disease, if there is a resistant agent versus the other disease, which led to the same outcome, but with sensitive agent. But we are amazed by these figures. So they calculated, they annually, well, I remind you, they said it's 700,000, but annually from the infection with resistant microorganisms. So the direct influence to mortality is 1.27 million. 1.27 million. If you add on here some mediated data, so that means when the resistance influenced negatively to the final outcome, the figure is 3.1 million a year. So the data is very impressive. And the other thing, just from the infection with the 700 staphylococcus, 700,000, 590,000 Klebsiella, resistant Klebsiella, and about 400,000 resistant pneumococcus. I'm not going into the depth of other figures. So the real figures showing us, and historically, who are dealing with that, that's very objective. Why do we speak so much about it? Because I want to show you our data on our country data. So there is a very big international resource, which is actually could be found in WHO data, and European data is there. So I will be guided by our own data. We'll look at the map of antibiotic resistance. As you know, from 1990s, we're dealing with that. And actually annually, we get from 6,000 to 9,000 of strains. And once again, this is not the data. These are strains. So we re-identify them in Smolensk and we measure the sensitivity. So the quality of data is super high from the point of methodology and the absence of variability. So let me show you the data for the last 2 years, 2021, 2022. So these are projects and 36 centers from 32 regions of Russia participated here. So we got 11,300 plus strains during pandemic. So we see that Enterobacteria is the leading one. So it takes 50%, and then Escherichia coli, Staphylococcus 12. But if you split them in types, and the leading is Klebsiella pneumonia, then Pseudomonas aeruginosa is the second one. So resistant Pseudomonas, 800,000. That's additional mortality. What happens in the country? So how pandemic influenced the rate of bacterial complications? Yes, it did influence them. This is our data. 53,000 hospitalized patients and 3/3 confirmed COVID. 60% were hospitalized into ICU. Pest control, 10%, they were getting different types of respiratory support. The rate of nosocomial infection was approximately 39%. And it is clear that the most frequent, these are lower respiratory tract infection. And this is the structure. On the one hand, structure is different. It is clear that patients in ICU, etc. But we see a very big dose of Staphylococcus, Klebsiella, and also plus to that Escherichia coli. Yes, structure is changed. But mainly, these are not changes of etiology, but the influence of the respiratory support. So no surprise. So how the resistance of main agents can influence? Well, with Pseudomonas aeruginosa, I'm not going to comment on that. We see that just polymyxin is working, and I'm extremely grateful to the Essential Drug List Commission with the Ministry of Health and Irina when she worked there very actively for the proper understanding, because our patients currently are getting those drugs which are essentially needed, and polymyxin, which was added, it's critically important for us, and also ceftazidime, avibactam, ceftolozane, avibactam. That's also life-saving, and they have proper activity for main agents. But I promised you our own data. What happens in the country? So this is Pseudomonas aeruginosa. This is aeruginosa, and this is some data. I show you just carbapenem resistance, but I want to tell you that in modern condition, what is very important, dear colleagues, microbiologists, it's very important to know molecular structure. Yes, that's a particular clone which is dominating in our country. But why microbiology is important? Please appreciate this 5, that's a mechanism of resistance. We believe that it could be the next epidemiological potential. And so we are the country which has dominating to OXA 2440 and OXA 23, and we can appreciate here for carbapenemase. So this is a European and Asian moment. We see here that OXA 24, OXA 40 dominates in European country, and to less rate in Asian. In Asian, it's mainly OXA 23, but we see that in average level of resistance is actually very high. Enterobacteria, well, also the same. We are OXA 48. We are very similar to many other countries of Southeast Asia with domination of OXA 48, because in Europe KPC is dominating, but in Russia KPC is also increasing due to St. Petersburg and Krasnodarsk region, Kurgansk and Sverdlovsk and Tyumensk region. So summing up on that, we see that there is no calamity. Pan resistance is not high, but multiple resistance or polar resistance is increasing, and figures are high for gram minus. So the use of antibiotics that Helena announced. So there are some positive examples, and mainly with vaccination. We see a recovery of sensitivity of pneumococcal to ceftriaxone, very clear correlation with conjugated vaccine for children. And we see, regardless from the human being, positive example and natural biological factors for us, effect of replacement of poly-resistant leads to the recovery of sensitivity of Staphylococcus aureus. So the use of antibiotics, colleagues. So we had a very good structure of antibiotics use before the pandemic in outpatient and hospital. Then it grew by 28%. Due to the titanic efforts in 2021, we managed to improve the situation, but the use actually due to the new neofloxacin, azithromycin, and very clear high level of resistance. What is important to mention, dear colleagues, in modern conditions, it's important to support microbiology because it's unprecedented story last year because regions got 5.8 billion Russian rubles and there were 133 labs and they purchased new equipment and they tried to make one strong laboratory in the region, and also many words of gratitude to the Ministry of Health and to the government. What is very important, what we can offer and what we are offering and already finalizing. I wanted to tell you that we need adequate local monitoring of resistance. And that is why, dear colleagues, that is why we established the whole ecosystem of the products that help our colleagues to be adequate and to deal with the monitoring of resistance. So we have a map. And let me remind you, this is just our data. So we established a special program product, and it allows any patients to identify resistance and not to create other different maps of anti-resistance. We have a program IMRC for molecular biologists and for clinicians. Let me show you just some examples, summing up my presentation. What is important, colleagues? It's important that, in fact, using it, we are not the owners of your data. You yourself either open, disclose your data, or you don't disclose. So what we did a locomotor that allows you to analyze that. So this is open platform that allows you to be used in 11 regions of our country. And it's very helpful to clinicians, and they're getting this type of dashboard. So scanning QR code by smartphone, they can get data on the resistance of the main agents in their departments. So the system is actively working. So please get to your site antibiotic.ru, so we will see. So I'm not speaking about MRCI. So summing up, dear colleagues, we established MR book. So this is like a reference book, definitely not branded, definitely properly updated in the online regimen. And by the way, it is available in the Google Stories. So colleagues, wrapping up, I would like to tell you that yes, pandemia showed additional challenges here, but we have all tools, availabilities, and mechanisms that allow us to minimize antimicrobial resistance.